going to get started because we want to make sure we give our presenters plenty of time for live demos. And the first few minutes, we're going to go through introductions. So first of all, my name is Pauline Nunez, and I lived in New Mexico for many years until the Census Bureau drove me over to Denver, Colorado. But greetings from the Denver region, which covers the 12-state region, including New Mexico. I also want to introduce Paulina Lopez, who is a partnership specialist that serves New Mexico, as well as Charlene McBride. So thank you, too, for joining us, and Paulina will be handling our webinar today. It gives me great pleasure to introduce Kendra Montanari, who is the Transportation Planning and Technical Services Manager for the Mid-Region Council of Governments. She will provide some introductory comments this morning. Kendra?
Good morning. Thank you, Pauline, for your commitment to New Mexico and to this region, and for always making sure that we have access to the greatest data and tools that we need to stay informed and make good decisions. Thanks to the rest of the Census team for being here today with us, and thanks to everyone on this call for taking time out of your business day to learn about what's new from the Census Bureau. Obviously, we all know that the census is critical for reapportionment and redistricting, certainly key to our funding formulas for schools and roads and social services and so many important things. But the other thing about the Census Bureau is just the depth of the data and the tools that they have available for everyday analysis. And so at Mr. COG, our role is to facilitate sound decision-making with a focus on transportation, land use, and the economy. And the policy leaders that make up our board need timely and reliable information. And so census data is really an important part of our ability to provide that. We use the census population estimates to help us know where we're growing, which helps us in funding transportation projects throughout the region. Census data also helps us formulate our comprehensive economic development strategy, which informs the allocation of funding from Economic Development Administration. And census community profiles are also used to help develop comprehensive plans for our local agencies to show us how our communities are growing and changing. We're also frequent users of census tools. For example, On the Map provides us with inflow and outflow data, and that helps us inform our local jurisdictions about commuting patterns. Census Business Builder generates business and demographic reports really at the click of a button for user-defined geographies. And Census QuickFacts provides quick community snapshots and side-by-side comparisons, so we know where our strengths are and we know where we need to improve. So these tools are great because they provide our member governments with easy stats in an easy-to-use format that can just be slipped into grants, reports, and other plans. So, you know, we are so excited to be here today to learn about some additional tools from the Census Bureau. Certainly, while the pandemic has transformed business and people, the Census Bureau is really helping us understand who's most vulnerable and where we might target our assistance. So thanks again for being here today, and I'll turn it back to you, Pauline.
Thank you, Kendra. I also wanted to introduce Susan Reagan, who will be she will be our facilitator for the question and answer period. So you will hear from her after the presentation. And now it gives me great pleasure to introduce the two presenters for this webinar. One is Andy Hait, who is a colleague and friend, and he is the economist with Economic Management Division with the U.S. Census Bureau, and Dr. Gabriel Amaro, Gabe, who is a survey statistician with the Small Area Modeling and Development Branch. Andy, if you will start.
Great. Thank you so much, Pauline. So thank you so much, Kendra, for the wonderful introduction. I love hearing how your organization uses Census Bureau data. And I'll say, in a lot of ways, it sounds like you could be giving this presentation today, given how much you know about the census data. So, but my presentation today, the presentation that Gabe and I are going to be doing, will focus on the resources that we have stood up in the last year to a year and a half or so regarding the coronavirus pandemic. As Kendra said so well, the Census Bureau produces an amazing wealth of demographic, socioeconomic, and housing data. These data from programs like the American Community Survey can be invaluable to businesses to help them understand their markets, to help them understand who are the customers of their business and maybe where is the best location for that business based upon where those customers are located. We also have programs in our economic directorate that measure businesses in New Mexico. Those business data can be incredibly valuable, again, to economic development groups because it helps them identify gaps in the economy. Here is a particular area where this particular sector of the economy is well served. There's plenty of businesses in that particular area in that sector, but maybe another sector isn't as well served. Maybe this is a good place for some healthcare businesses or something else. As great as those data sets are, though, they have one challenge, and that is timeliness. The latest data we have from the American Community Survey is 2019, same thing for many of our business programs. So while these data can be really valuable in helping us understand what the potential impacts of a disaster or a pandemic are, they are not quite as valuable in terms of measuring the actual impacts. So that's what we're going to be talking about today. And the very first program that I'm going to talk about is something called business formation statistics. The Census Bureau has a one-way working relationship with the Internal Revenue Service. If I was interested in retiring from the Census Bureau and I wanted to open my own Greek restaurant, let's say, one of the first steps I would do in opening that restaurant is I would contact the IRS and I would request an employer identification number, an EIN. I need that EIN because when I start filing business taxes for my business, I'm going to need that particular code. Every single month, we receive from the IRS updates on how many businesses have requested employer identification numbers, EINs. And historically, we've used that data to update our business register, which is our database of every known business in America. We maintain this database because it is then the basis for all of our sample surveys that we conduct every month, every quarter, and every year. The business register is the basis of our economic census. If you want to get a census of all the businesses in New Mexico, you would need a full list of all the businesses in New Mexico. So we rely on this data file from the IRS to reflect these new births, these new businesses. But at the very beginnings of the pandemic, we noticed that the number of filings, the number of business applications that were coming into the IRS had dropped off markedly. A lot of people who had thought about starting a business at the beginning of the pandemic said, maybe now is not a good time, and they put off those plans. Well, we decided instead of simply bundling this information and publishing it annually as part of our business formation statistics, we would start publishing this data weekly. So as you can see on the slide, we published information on business applications down to the nation, region, and state levels for every single week during 2020 up until the end of the year. Those weekly applications information is available at the link that I have here on the slide. Since the beginning of January, though, this program has transitioned to a monthly and quarterly survey, and I've provided the links to the two sources where you can go and actually access that information. Bottom left-hand corner is the link to the Business Formation Statistics homepage, and in the right-hand side is a link to our time series and trend charts, which allow you to look at business formations in the state of New Mexico over time. You can see in the line graph that there is a seasonal up and down that normally happens in a state where you see a drop-off in business applications in certain months and then an increase in business applications in other months. But you'll see that there was a pretty substantial drop-off in 2020, but now a big increase. So when you're thinking about business growth in New Mexico and how businesses are responding to the pandemic, getting access that would allow you to see how many business startups were there in the state could be really valuable. Second program I want to talk about is the Small Business Pulse Survey. This survey was stood up in April of last year, and it asks small businesses across the United States how they've been impacted by the pandemic. It asks them basic questions on things like what the overall impact is, but it also asks them detailed questions on things like, did your business start adopting new business practices due to the pandemic? The Small Business Pulse Survey has been conducted in a series of phases. And in each of the phases, we have changed the questions that we are asking on the survey to have them be representative of where we are in our economy right now, where we are in the pandemic. Asking a business at the start of the pandemic, have you had to shut down due to closure orders? That was appropriate. Asking them that same question now, probably not so appropriate. So we have published data through phase 1, 2, and 3 of the Small Business Pulse Survey. And just about 2 weeks ago, we started collecting data in phase 4. As we have gone from each of these phases, the questions we've been asking, as I said, have changed, and we've taken user feedback a lot. So as you browse the questions that we ask on this survey, you look at how New Mexico has been impacted, small businesses in New Mexico have been impacted by the pandemic, I would encourage you to think about the types of data that you might need for your purposes and contact us with information. This survey is interesting because it not only publishes data by geography, but also by sector. So over on the right-hand side, we can see a bar chart that shows how many businesses or what the impact was by NAICS sector. NAICS 72, excuse me, which is the second to last bar on the right, that is the accommodation and food services sector. This is the sector that, of course, that we have heard has been most impacted by the pandemic. Restaurants and hotels really took a beating, but you will notice that just to the left of it is NAICS 71, which is the arts, entertainment, and recreation sector. This is an important sector in New Mexico, and being able to understand how small businesses in that sector in your state have been impacted would be really important, because recently there's been some new legislation passed that is now going to be offering special funding to arts companies, performing art businesses, for example, that will allow them to now get back on their feet, specifically for those types of businesses. So this is a great survey to understand how small businesses have been impacted. Now, we've also conducted a household pulse survey. Like the Small Business Pulse Survey, this was a weekly program. We started publishing data again back in April. The data are shown at the national, state, and in this case, metropolitan area level too. So you do have metro area level data, and it asked about 30 or 40 different questions about how people's households were being impacted by the pandemic. Like the Small Business Pulse Survey, the questions that we asked on Household Pulse have evolved over time. So what you're looking at right now is a screenshot of what the Household Pulse Survey looked like back in January. But we can see those questions are likely to be changing over time. This survey completed phase 3 a couple of weeks ago, and they are working on standing up phase 4 right now. It'll probably be sometime in the beginning of April when we'll start having updated information from the Household Pulse Survey. Now, the visualization that you are seeing here on the slide, the link to it is at the bottom of the slide, and yes, the slides are being shared with you all, so you don't need to frantically be writing down these URLs. But the visualization that you see here displays about 9 of the different questions that were asked on the Household Pulse Survey. They are not the only questions. As I mentioned before, we asked almost 30 questions. So I have provided on the left-hand side the link to the data link, where you can go in and look at not only these data for the state of New Mexico and for metropolitan areas, but you can also look at data for the other questions, the full set of data that's available from this program. Now, the next program we're going to be talking about is the Community Resilience Estimate. And for this program, I'm actually going to be turning the presentation over to my colleague, Gabriel, and he will go ahead and talk with you all about this really fantastic program called CRE. After Gabe does his presentation, I'll come back. I'll do a quick demo for you all of the COVID-19 Data Hub, which is a a platform that we stood up specifically to present these statistics, and then we'll take your questions at the end. So with that, Gabe, it is all yours.
Thanks, Andy. I'm going to go ahead and share my screen now. Looks like it should be coming up. There we go. All right, so I'm Gabriel Amaro. I am a survey statistician with the Census Bureau in the Small Area Modeling and Development Branch, and I'm part of the small team that of about 6 to 7 people that created this new data product called Community Resilience Estimates. And what this is this product was developed with COVID-19 in mind, and this presentation that I'm going to go through is focused on the CRE as it relates to COVID-19 vaccine distribution. So I hope you'll find this interesting. The first few slides, as I start getting into the presentation, I'll actually move pretty quickly through them because they're pretty broad-based slides, but I want to jump into examples that are specific to New Mexico that I think will be interesting to everybody. So let's get this presentation started. So resilience, I start from the beginning with resilience because even though a lot of folks know what resilience means, but there's many definitions for community resilience. How we define resilience as it relates to the community resilience estimates. It's a measure of the capacity of individuals and households within a community to absorb, endure, and recover from the external stresses of the impacts of a disaster. Regardless of the definition you use, we know that resilience can be predicted by individual and household characteristics. So there's already, when it comes to resilience measures and social vulnerability measures, there's already several out there that exist. So if there's already several out there that exist, I think it's great to talk about why the Census Bureau should measure resilience. If you're familiar with the most popular measure being used right now for COVID-19 vaccine distribution, as well as in the past, just looking at social vulnerability, it would be the CDC's Social Vulnerability Index. So that's definitely the most popular one that's out there. But all of the current measures of resilience and vulnerability derive from publicly available census data. So it's developed using decennial data or American Community Survey data. So the problem with that is that those measures are deficient in granularity and accuracy. In accuracy, I actually spend a couple of slides on talking about what I mean, like with the current measures that are out there. They actually, a lot of the measures have lots of error, and I'll explain why. And so this is where the Census Bureau, I think, is in a great position because the Census Bureau, we are the stewards of the restricted data. So when the population is filling out surveys and answering questions regarding personal details about their household, about themselves, we maintain that data and we hold it at the Census Bureau. We don't release it to anybody, and so we are the stewards of that data. The community resilience measures are developed using American Community Survey restricted microdata. And the neat thing about that is that we're able to retain the correlation of individual risks. So if you're familiar with, so I actually saw on the attendee list that there's a lot of researchers and data scientists, and so if you're familiar with current publicly available census data, and I used to be a researcher at UT Austin, so I know what it's like to use public census data. The neat thing about it is that I can look up census tract information, right? If I'm using ACS data, and for a particular neighborhood or census tract, I can find out the percentage of the population that is maybe over the age of 65. I can find out the percentage of the population that does not have a high school diploma. So over 65, that's one layer. And then the education variable, that's another layer. And then let's say I want to know who's in poverty. I can find out the percentage that is living in poverty. So that's 3 layers, right? Well, with restricted microdata, I can jump down to the individual level and I can find out the person who is over 65. That person might also be in poverty. that person might also not have a high school diploma. Maybe they are also living with a disability and they also have heart disease. So I can actually maintain that correlation. So that's 5 risk factors already, and I can maintain that information using the restricted microdata. So using that data available only at the Census Bureau internally, we can identify the most vulnerable of the vulnerable population. So if we're looking to ensure equitable distribution of the COVID-19 vaccine, the CRE is going to be the best measure to use. So I'm going to skip the first bullet because I want to give more time to Andy so he can give you a live demonstration of the dashboard later on. But what we do with the CRE is we assign these risk flags to individuals, like I talked about already, and they're cumulative. These risk flags are cumulative up to 11 risk categories. So if we move on to the next slide, here are the risk categories. So over 65, living with a disability, maybe they live in a crowded household or a crowded community, et cetera, et cetera. These risk flags were chosen. So we started developing the CRE around March or April of last year. So these risk flags were chosen based off of early research that looked at the COVID-19. Right, so COVID-19 was still very new to everybody, and we were still finding out who was most at risk of developing severe illness. And so as we found out, as we know now, right, that folks with respiratory disease or heart disease, diabetes, or with a disability, they're more likely to develop severe illness. So that's why we chose these particular risk flags. So what we end up having is the community resilience estimate. It's a tract level estimate, also available at county geography, of the number of individuals by the number of risk factors they're living with. And we categorize them into 3 groups. So we have the no risk group, which is 0 persons living with 0 risk factors, the medium risk group, which are those living with 1 to 2 risk factors, and then the 3 or more risk group, and that's the most vulnerable of the vulnerable. So they're the high risk group. And this is what it looks like when we're looking at it on a map. So Andy will show you their community resilience dashboard later on, and so you can actually zoom in and out and take a look at areas that you're interested in. So what we're looking at now is the state of New Mexico, of course, but we're looking at it at the county level. So darker counties have a higher percentage or a higher proportion of the population living with 3 or more risk factors. But as we know, once you deep dive into a county, there's variation within the county, right? So once we deep dive into a county, we can see here that there's variation by tract. Some tracts have at over 50% of the population living with 3 or more risk factors. So we would definitely categorize that as a high-risk tract. And then, of course, the lighter colors have, less, a smaller proportion, between 0 to 20 of the population living with 3 or more risk factors. So early on, I talked about existing measures and how they are deficient in granularity and accuracy. So I'd like to talk a little bit about the Social Vulnerability Index because it's the most popular measure being used right now for community resilience as well as for COVID-19 vaccine distribution. If you're not familiar with the SVI, what it is it indicates the relative vulnerability of every U.S. Census tract. It ranks the tracts on 15 variables, 15 social factors. It groups them into 4 related themes. So each tract receives different rankings, if that makes sense. You get a ranking for each of the 4 themes, and most importantly, you get an overall ranking. So you can use the SVI to find the most vulnerable tract in the U.S. as it relates to other tracts in the U.S. But the reason why I like to talk about the SVI is because it uses publicly available census data. And it's so, it relates so much to this article that NBC News actually just published a few weeks ago. What happened there was the state of New York had resources to open up 4 vaccine sites, if I remember correctly, 4 vaccine sites in in certain counties in the state. So what they wanted to do is they used the SBI to identify the most vulnerable counties in New York State, and since they had limited resources, right, they can only open up 4 sites. So according to the SBI, one of the 4 counties was a sparsely populated county that was mostly wine vineyards. So according to the SBI, that county was the most vulnerable county, one of the most vulnerable counties in the state. So the state pushed back on using federal funds to open up a vaccine site in this county because it's clearly not going to be the best use of the funds. They wanted to use something else, essentially. They wanted to use something else to find the most vulnerable counties where they could put make the best use of the limited resources. So what the state of New York ended up experiencing was what we had already known at the Census Bureau when we developed the CRE, because we did work with the SBI to see if the Census Bureau is going to create a resilience measure, how can we improve what's already out there, or how is it going to be better than what's already out there? So this chart that you see there is actually a chart that we have out of like 60 or 70 slides where we look at this SBI in many different ways, and we look at the top 10% high-risk census tracts according to the SBI, and we see how much error is in that particular tract. So what we found was that the top 10% high-risk tracts in the SBI also come with the most amount of error. So data scientists, researchers, if you're familiar with data, you get the margin of error, right? You get the sampling error. If you're looking at a neighborhood that has 1,000 people living in poverty, but it has a 950 person margin of error, that means you can have as little as 50 people living in poverty up to 1,950 people living in poverty. So that's a lot of error. And do you pay attention to that tract? Well, maybe you do, maybe you don't. But the SBI, the way it's constructed, it does not pay attention to that. It does not pay attention to sampling error or margin of error. So all it does is it just stacks all of these variables on top of each other and then just sums them up and then creates the overall ranking without any kind of analysis looking into errors. So what does this mean? So here's a tract that we're looking at in Sierra County, New Mexico. According to the SBI, this tract is the overall ranking is 0.15, and so the SBI, the overall ranking ranges between 0 and 1. So 0.15 is actually pretty low risk, actually, according to the SBI. But if you look at this tract using the CRE, we find that 46% of the population in this tract is living with 3 or more risk factors. So anything over 30% for us, we would categorize as high risk. And so there's a lot of tracts like that in New Mexico. There's a lot of tracts like that all over the U.S. where they're classified as high risk, but they're actually low risk according to the CRE. They may be categorized as low risk according to the SBI, but they're high risk according to the CRE. So it's usually on those tail ends where you find the biggest differences. And the biggest issue is with the high risk tracts, right? Because if you have limited resources and you want to distribute a vaccine and you look at the high risk tract according to the SBI, it may very well not be a high risk tract. So what do we suggest? If you're looking to identify the most at-risk population for equitable distribution of the COVID-19 vaccine, we suggest using the CRE. The cumulative risk factor estimate is unlike any other data that's available to the public. And so what we're also saying too is we're not saying stop using the SBI, because we actually had a question about that in one of our presentations. So do we recommend not using the SBI? We don't say to not use the SBI or any other measure for that matter. We recommend using everything that you have access to. So if you still prefer to use the SBI, confirm your findings using the CRE. That's kind of what we would recommend. If you're looking for reliability and accuracy, use the CRE. It's the most accurate measure that's out there right now. And it can be used in conjunction with other data. So we have some folks who have used it to overlay on a map and see the COVID cases or deaths by COVID. They've been using it to look at job or economic distributions like persons working in animal processing plants and so forth. So with that being said, I'm going to end it right here, and I'm going to hand this presentation back to Andy, who can jump back into the dashboard and give you a live demonstration of how to maneuver the data on our COVID-19 hub. Andy?
Great. Thank you so much, Gabe. So CRE is a fantastic program. I'm sure you all have figured that out from Gabriel's really good walkthrough of that. So far we've talked about 4 of the 6 programs that were stood up during the coronavirus pandemic to help measure the impact of the pandemic on our households and on our businesses. The 2 that are on this slide are the last 2. The first one is a program called Selected Monthly State Sales Tax Collections. This survey was specifically stood up to help users understand the impacts of the pandemic on state and local governments. We all know that households are being impacted. We know that businesses are being impacted. But a lot of people were asking, well, how are governments being impacted? I'm sure that governments has had some type of potentially negative and positive impacts of the pandemic. So what this survey does is it looks at monthly state sales tax collections. In Maryland, where I live, for example, the gasoline taxes are extraordinarily high. So the state of Maryland relies a lot on gas taxes as a key source of revenue for the state. With all of us, or so many of us, not driving as much as we used to drive prior to the pandemic, I actually have not been to the Census Bureau since March of last year, just reached the 1-year mark of not being back at the Census Bureau. So I am putting hardly any miles on my nice new truck sitting out in my driveway. So the state has seen a marked decline in those state sales tax collections. So this is a great survey for you to see how is the state of New Mexico being impacted. The other survey is our monthly state retail sales report. Many of you are familiar with our monthly retail trade survey, which is one of the 17 leading economic indicator surveys that we do each and every month that tracks retail sales by industry at the national level. People loved the March survey because it provides very timely information on the retail sector. You could see, for example, right at the beginning of the pandemic, that certain retail industries were really taking a beating where others actually were soaring. We published data for NAICS industry called non-store retailers. It's what we typically think of as online shopping. The online shopping industry boomed during the pandemic. I know I certainly did my fair share of encouraging that industry to grow in buying as much as I did through Amazon and a lot of the other online retailers. But as great as March is, that survey only published data at the national level. We realized that retail sales by state are not consistent across the nation. There are some states that rely on retail sales and the retail sector in general more than others. So this survey actually provides information at the state level on retail sales. And if you look at the data for New Mexico, you could see that New Mexico retail sales actually did not take quite as bad a hit as some other states. So it's an interesting comparison to look at. Now, throughout the entire pandemic and releasing all of these great surveys, we could have been mean, and we could have made each of you go in one at a time into each of the individual program pages to access the data from those 6 different surveys and data from the American Community Survey, data from our economic census, etc. But we thought that that would be not such a great idea, that it would be better for us to assemble together into one main portal the information that you all might need to help understand how the state of New Mexico and how counties in New Mexico and tracts in New Mexico are being impacted by the pandemic. So what you are looking at on your screen right now is a screenshot of two of the components of the COVID-19 Data Hub. On the upper left-hand corner of the slide is a screenshot of our impact planning report. This allows users to go in and look at data at the state and county level. It includes basic statistics from the American Community Survey and from some of our business programs. It is a two-page report. That little arrow down on the right-hand side of the dashboard allows you to see the second page. It is fully manipulable, and this dashboard has actually changed quite a bit over the past year. And we are planning an update to this dashboard. On the right-hand side is some information on the health insurance coverage by age. These data were really important during the beginnings and middle of the pandemic, but right now they're probably not quite as important. So we are going to be replacing that portion of the dashboard with information on occupation. We know, for example, that vaccine is being distributed to certain occupations before others. In the state of Maryland, where I live, healthcare workers, of course, were in one of the first groups, but they just recently promoted, if you will, education workers up to that for one of those first groups. So this report will allow you to see how many of those workers are there in New Mexico and in your counties. On the right-hand side are some things that we call policy maps that allow you to go in and browse specific statistics for the state of New Mexico and by county and even down to census tract level. I have provided the link to the COVID-19 Data Hub, but I'm going to now go ahead and actually jump out live and show you the hub live. So to get to the COVID-19 Data Hub, if we go to Browse by Topic on the main census.gov website, and then click on Emergency Management, that'll bring us to our Emergency Management page. If I then scroll down and choose this icon over here on the right for the coronavirus pandemic, that'll then refresh this recent events panel to the new coronavirus page. And if I then click on that, I'm now going to come to our coronavirus pandemic resource page. At the top of the page is a link to the hub. So if I click on that link, that is now going to bring me to this particular page where I can look at some basic information about the population and businesses in the United States. Right now, this is defaulting to the state of Alabama, but if I now want to go ahead and change this to New Mexico, I can go ahead and choose New Mexico. I went past it. Oops. Go back to, let's see, where did it go? Here we go. So here's New Mexico. Once I have chosen New Mexico, it's now going to refresh the data for the state of New Mexico. And now if I want to actually choose a particular county in New Mexico, let's choose Bernalillo County, I can go ahead and choose that. And now the dashboard is going to refresh, and it's going to be the dashboard that we were just looking at on my screenshot. In Bernalillo County, there's 15,902 employer businesses with 270,000 workers in those businesses. 43,729 people live or households are below the poverty level in Bernalillo County. And here's some additional information on the second page: language spoken at home, other types of statistics like that. Scrolling down, I come down to this panel that allows me to go in and look at data specifically on those 6 programs that I talked about: business formation statistics, the small business pulse survey, the household pulse survey, community resilience estimates, and these 2 new ones for monthly state sales taxes and state retail sales. You will also notice that we added a link to the international population data, our international population database. As Gabe mentioned, we have, for each of these programs, a special dashboard specifically created. So if you want to go in and actually look at the information for the state of New Mexico, I can look at that by actually browsing on the map, or I can go in and use the menu at the very top. I can select a particular state. Let's go ahead and choose New Mexico from the list here. The application is now going to zoom in to New Mexico, and I can go in and drill in further. I can look at the percentage of the residents that are in New Mexico that have 0 risk factors. 20% of the population have no risk factors. 50% of the population have between 1 and 2 risk factors, and 30% of the population have 3 or more risk factors. You can look at in terms of percentages of the residents as well as the number of residents that are falling into those categories. And as Gabe mentioned, I can go in and I actually can go in and look at data for a specific county, zoom in on that particular county, and I can further zoom in and look at the data at the tract level. So we could further zoom in on this map and see what are those tracts that Gabe was talking about that have a very high percentage of the population that are living with 3 or more risk factors. So we can see we can actually click on this particular tract. So that this is tract 37.91 in Bernalillo County. 5,565 is the total population, and 50.87% of the population have 3 or more risk factors, which equates to 2,831 residents that have 3 or more risk factors. So this is a pretty high risk sort of community. So this is a great way to go in and actually browse the information from the community resilience estimates. Of course, you can download the data from the COVID-19 Data Hub, including all of these dashboards. Now, if I scroll down some more, we get down to those policy maps. Again, I can zoom in specifically on the state of New Mexico and go in and look at data from 9 different key topics in these policy maps at the state and county level. The Hub also does allow users to go in and download the bulk data. And one of the key features of this Hub is the ability to download the data as either a CSV or Excel file, but also to be able to bring it down as a reference layer. So for those of you who have GIS professionals that work in your offices, maybe that you're building your own particular hub or your own particular dashboard showing information about the state of New Mexico or your county, you can actually download all of this data that we have here on the Hub available to you and incorporate it into your own dashboards. The last thing I want to mention about the Coronavirus Data Hub is this new section that we added in version 2.0 of the Hub. Back in November, beginning of December, FEMA approached the Census Bureau. We had been working with them for quite some time, and they said they had been curating a pile of databases from across the federal government on the Argonne National Labs website. For those of you who are not familiar with ANL, this is a fairly tightly controlled government website. Mostly federal employees have access to it. But they had been using ANL as the repository for this really rich set of data about the coronavirus pandemic. And they asked the Census Bureau, would we be interested in hosting some of that information or in providing links to some of that data to help make the data accessible to a larger audience? They were really interested in expanding these data to a larger group and realized that ANL just was not going to be the site to do that. We thought about it for about 5 minutes and realized, yes, we definitely wanted to do that. So as you can see, we have incorporated 38 different data sets from across a wide variety, 17 actually, of different organizations. These include federal government agencies, CDC, DEA, HUD, SBA, USDA, et cetera, but they also include some third-party private sector databases. So if I click on this Open Datasets page, it will actually now bring me to the list of all the different data sets. They are grouped into 3 broad categories. So if I want to find out what are all the data that we have that are related to business and economics, I can click on that tab. If I want to look at data on individuals and households, I can click on this tab. And if I wanted to get data on government services, I click on the 3rd tab. As a tip, all of the tribal data that we have available in this site is available under this government services tab. So if you're looking for tribal geography or tribal data, that is available under individuals and household and government services. When I click on one of these categories, I'm going to get a list of every single data set that is available under that broad category. So, for example, if you're interested in looking at how were CARES Act monies distributed to counties in New Mexico, did that distribution align with the population in the state and in those counties? Are there some counties that got more than others? How much more? Those types of information would be available by going to this link. You can see the link does show that this data set, this CARES Act data set, does publish data at the state and county level. What I will let you know is that what you're going to experience when you go to each of these different sites varies from provider to provider. Some agencies did a really fabulous job, I think, of presenting their CARES Act or their COVID-related data to data users in a very user-friendly way, some not quite so much. So this is a start. We are recognizing that this is not what we are probably going to want to leave it as. We're going to want to be able to actually incorporate some more information than this and actually perhaps pre-process some of this data for you. But we think that it is a good first step that would allow people to go in and actually merge together these data from these other data sources with Census Bureau data and your own data to be able to go in and actually make some really important findings. One project that I personally am working on right now is I am working on a project that is going to be mashing up this PPP loan data with our Small Business Pulse Survey data to see how did the small businesses that were impacted align with the monies that were distributed to businesses via the PPP loans and via the EIDL, the Economic Injury Disaster Loans, EIDL loans. Those are both available from this SBA website. So with that, I'm going to jump back out over to my PowerPoint slides and just sort of close this out. So as I mentioned before, we have been collecting a lot of feedback about these different programs that we've been conducting over the last year and the platforms that we've been creating to make those data accessible. And we really want to hear your feedback. What are the things that we are doing well? What are the data that you really like here? How are you using that data in your work? But we also want to know, what is it missing? Since we added this new additional federal agency portion of the COVID Hub, I've gotten probably 30 requests for adding additional data sets that are not currently available in this hub. I would very much like to hear how you all think of this, or is this something that is actually working for you? So with that, I am actually done. Susan, if you want to see if we have anybody that has any questions in the chat, or maybe has any questions that they want to ask live over the phone, that would be fantastic.
So this is a great time to take a pause. There are some really good questions in the chat, and I think the first one was around the sales tax feature, and would it be expanded to include geographies smaller than state level?
So yeah, great question, Susan. Right now, the way we publish state and local government sales taxes is it's published at the state level, but you do have the breakout of state sales tax versus local sales tax. If a person wanted to look at a specific local government and look at their sales tax collections, then what we would have to do is they would actually have to look at the individual unit files. This public sector program publishes the micro data. It's all considered public record, so there's no privacy concerns. So they could actually go in and look at that data, but they don't actually regularly publish that type of information. It is available. You just have to kind of dig a little bit for it. Great question.
So there was a suggestion here for other possible risk factors and their comment was percent of population spending more than 35% of their income on housing, grandparents raising children, female head of household families, and industry diversity.
I can speak to that. Thank you for those recommendations, actually, and I already sent that recommendation over to my team. So we definitely like these kinds of comments because, when we first developed the CRE, it was developed, like I mentioned, using early research, early COVID-19 research, and so we are coming out with new iterations in the future. And so we can consider new risk factors. And so this is perfect. I already sent off that suggestion to my team, and we're going to review it. It's likely that we could include some of those factors in there. So thank you.
And just a tag on to that, somebody also said environmental data would be useful to add to this.
Yeah, and so the CRE, as it's currently available, was created in response to the COVID-19 pandemic, but we are going to come out with different iterations that will be more applied for natural disasters such as hurricanes, tornadoes, and flooding. And so we are going to be including in that type of environmental data as well. So thank you for that.
So we also had a question, is this data going to be integrating the 2020 census data? If you're my data people, you know the 2020 census data has not been released yet, right? So what year is the data from?
So the CRE, I can speak to the CRE. It was developed using 2018.
Gabe, we lost you.
Oh, can you hear me now? Sorry.
Yes, we can hear you now. Mm-hmm.
Yeah, so the CRE is developed using 2018 ACS 1 year. And so 1 year has a large enough sample for us, at least the microdata is a large enough sample for us to use. And 2019 ACS data was just released a few months ago, and so the new iteration of the CRE will have 2019 data. And of course, when the 2020 data is released, we'll also use that too.
Yeah, and I'll echo Gabe's comment on the other data that's in the COVID hub. The demographic data that's in the impact planning report is from the 2019 ACS estimates. We did update that when the data came out live in December. The business data is from 2018. And obviously, those 6 different programs are actually very current data as of just the last couple of weeks. When the 2020 data, decennial census data, do come out, we are planning on actually updating the ACS data that's in here to the 2020, or at least adding the 2020 decennial data. But the question really is going to be, what is this hub and what is this platform going to look like in September of this year? Where will we be as a nation in terms of the pandemic? Will we need some of these resources, or will things transition and we'll now be wanting to look at different data in this platform? So we're definitely collecting a lot of feedback from users about what's useful, what's important data to have for that particular phase where we are in the pandemic.
So I'm not seeing any other questions. If anybody has anything, go ahead, Pauline.
Susan, there was one from Alana Purdy Montesinos about poverty data. Did you see that one?
I see that. Poverty data would be something they'd like in the hub.
Well, can you show how to look at poverty data in New Mexico, as in how the pandemic impacted poverty rates in New Mexico?
So there is some poverty data. Let me go back over to the hub itself. We've incorporated some of the poverty information into here. So here at the very top of the hub, we have some information on poverty levels in this middle portion of the page. Over here, I think there was some poverty data on the first page. Yes, there's some data on poverty in the very first page of the hub. Scrolling down, we have poverty data included into one of these maps. So if we want to look specifically, this is percentage of households with less than $75,000 worth of income. When the map eventually builds, you'll be able to see that information, and that's available at the national, state, and county levels. And the poverty data that's in the hub is also available for download. So here's the population below poverty. You can go in and read the information and then download that data, bring it down as either a CSV or an Excel file, or bring it down as a shape file to be able to incorporate it right into your own work. So yeah, we've included some information. Whether it's all the information you're interested in, that's a good question.
There was also a comment from users, Susan.
So I see here, Camille says, do we have permission to post some of this information on our website? And I'm going to answer, it's decennial census data, or it's census-based data, and so it is in the public realm. You may use that. Just cite it. And then Kendra says, thanks for the small data estimates work that is being done. It's so valuable to have sub-county data available. Keep it coming. And I'm going to say, that Andy, as always, your presentations give me a clue into data that I hadn't realized you had available. And thank you and Gabriel for your presentation, because I didn't really understand the community resilience estimates, and I actually have a better handle on it now.
Yeah, CRE, Susan, is a really great program. And of the 6 that we talked about today, it is the one that is likely to live well beyond the pandemic, because, again, the ability to assign individual risk factors to that ACS micro-level data would allow us to tailor those estimates to specific types of disasters. As Gabe pointed out, these estimates that were created use 11 risk factors that are related to the pandemic. But the risk factors that you might need to look at when you think about other types of disasters. This past year was a pretty scary one in terms of hurricanes, not so much affecting New Mexico, but you all had certainly had enough on the fire side, and the rest of the nation was affected by floods and other types of disasters, that being able to have a program like CRE that allows users to look at how resilient or how not resilient their communities are to different types of disasters would be really important. So I'm particularly fond of CRE. That's why I was so happy when Pauline first asked us to come and speak to this. And Gabe does a great job of talking about this really interesting program. So thank you, Susan, for inviting us and for having such a great group.
There was one more comment. It would be great if the Bureau developed some more friendly language explaining the CRE data. I can understand the technical information well enough, but I will require some thought to make it not just digestible, but impactful for my public officials or even the writers at my local paper. I thought we didn't want to miss that comment.
That was a very good comment, and I've already submitted a request. So what I'm going to do is I'm going to create a one-pager that's basically going to summarize kind of what we all saw today, and it's going to be different than the technical documentation, and it'll have like maybe a comparison, and I hope that we can include our Census graphics team to make it sort of like a flyer, if that makes sense, right? So yeah, that was a good comment.
I'll add one more thing to that also, Gabe. Some of you are already familiar with this site, but we have a page on census.gov called America Counts. It is a collection of stories about Census Bureau data. And I happen to know from insider knowledge from a meeting this morning that there is an America Counts story underway or maybe in the works, specifically on the community resilience estimates. So explaining the real value of this program and highlighting some of the key features of it in a more plain language sort of way. So if you haven't checked out America Counts, there's some really fantastic stories out there that have been released just over the last couple of months, specifically highlighting data from the Small Business Pulse Survey and the Household Pulse Survey, and the other programs we've been conducting, business formation statistics. So yeah, check that out. That's a great place to go if all of this census ease has made your head hurt.
Never makes the head hurt. So we actually have 2 comments. Water data would be useful for those of us out here in the West. And then also somebody who's curious about capturing business data by minority-owned businesses. I know the answer, but I think, Andy, that would be a good one for you to. Sure.
So we actually now have 2 programs that publish information on minority, women, and veteran-owned businesses. The first is a program called the Annual Business Survey, ABS, publishes information on employer businesses. So these are businesses with 1 or more paid employees. The data are broken out by race, ethnicity, gender, and veteran status, by industry, by geography. And yes, you can drill down to even city and town level data. The data do get a little thin, especially in states like New Mexico. So some of your smaller geographies, the data is really not going to be available, but it does let you drill down. The other program, the second program, is actually a brand new one. And Susan, you may or may not be familiar with this one, but it is a program called Non-Employer Statistics Demographics, NESD. One of the things that people complained about with ABS was that unlike the old survey of business owners that covered both employer businesses and self-employed people, ABS only covers the employer businesses. It doesn't cover self-employed people. And a lot of people were saying that's a bummer because there are a lot of minority and women-owned small businesses in my communities, and many of them are not employer businesses. These are people who get a 1099 and report their business income on the 1040 Schedule C or 1040 Schedule SE. NESD, this new non-employer statistics program, plugs that gap. So we now actually have data, similar data on race, ethnicity, gender, and veteran status, but for both employers and non-employers. We are actually working on an update to add some of that ABS and NESD data to the COVID hub, because we know that it is likely that many of these types of businesses are being impacted differently than small businesses are. But I would honestly love to hear your feedback on exactly what you'd like us to add there. I'm putting my slide back up with my email address and my phone number as well as Gabe's. If you haven't asked your question already and you want to follow up with us after the presentation, please feel free to either email us or give us a call. And I'd love to hear sort of how you would think about incorporating the ABS data into the hub.
Well, with that, thank you, Susan, for this lively conversation with Q&A. And of course, thank you so much, Andy and Gabe, for such wonderful presentations and bringing such good information to the state of New Mexico. So everyone, thank you for participating, and you will be getting a recording link as well as Andy and Gabe's presentations today. Thank you so much, and again, many thanks to Mid-Region Council Governments, Kendra, and the State Data Center, Susan Reagan. Thank you again. Bye.